I'm Dr. Andrew Siegel. I'm a practicing urologist and have been so for over 30 years. I see prostate cancer patients every day. Prostate cancer is incredibly common, the most common male malignancy excluding skin cancer. Some would refer to prostate cancer as the male breast cancer. 1 of 9 American men in their lifetime will develop prostate cancer. My new book, Prostate Cancer 2020, a practical guide to understanding management options for patients and their families, started out in the form of a brochure I wrote probably about 10 years ago, out of frustration from the lack of a streamlined, practical, and trustworthy resource to help patients and their families navigate through the challenges of a prostate cancer diagnosis. I made it available in my office, and many patients found it helpful. Over the last decade, and particularly in the last 5 years, an incredible number of advances in prostate cancer diagnosis and treatment have occurred. Refinements in screening, prevention, sophisticated new imaging techniques, genetic and genomic testing, active surveillance, technical progress in surgical, radiation, and focal therapies, and the availability of numerous new medications for advanced prostate cancer. So, I decided to expand my booklet into an updated and comprehensive book called Prostate Cancer 2020. 2020 is a nod to the year looming in the near future, signifying the up-to-date and topical content, and also to refer to 2020 vision, the clarity and perspective that I wish to impart. While there is absolutely no substitute for a thorough urological consultation, time constraints rarely allow for a comprehensive and exhaustive review of everything that you need to know. Because prostate cancer is potentially life-threatening, emphasis is generally placed on curing the disease, while counseling and education about urinary and sexual side effects are often given lower priority. My book is intended as a supplement and complement to your urology consult, an all-inclusive source explaining diagnosis, treatment, and side effects. While the book is primarily written for newly diagnosed patients looking for answers, it is also intended for those patients who relapse following primary therapies, those patients who have complications following treatments, family members of prostate cancer patients who are interested in learning more about the disease, and for anyone interested in learning more about prostate cancer. Every case of prostate cancer is unique and has a variable biological behavior. This creates a need for treatment that is both individualized and nuanced. The bewildering array of management options can cause confusion for the patient and his family grappling with determining the best approach. My aim in this book is to provide guidance, impartially reviewing the pros and cons of every option. Being informed empowers you and your loved ones to be actively involved in decisions about your care, enabling you to choose the treatment that is best suited to your situation.